Hello everyone, this is Hamza from Dr. Nerd. Actually, I'm doing this lecture for the second time because in the first time I was doing it with the mic off. So today we will talk about the second pathology lecture, which is the cellular injury. We will talk about what is the cellular injury and the causes of cellular injury and the types of injury that can occur to the cell. So in this picture here, uh, you can see it's a small summary for the lecture we will talk about now. Firstly, we have the normal cell, which is in the homeostasis situation. Two things can occur to the cell. Any injurious stimulation can lead to an injury immediately, or any increase or decrease in the stress, as we said in the previous lecture, will lead to cell adaptation. Cell adaptation, if it occurs for a long time, the cell cannot adapt anymore, cannot handle the stress. Then it will go to cellular injury. Cellular injury, after the cell gets injured, we have two types of injury. First one is the reversible injury, which occurs when the progressive of the injury is mild, and it can be treated and go back to the homeostasis situation. But if the progressive of the injury is severe, it will lead to something called irreversible injury, and this will lead to necrosis or apoptosis. And these two are two different ways for cell death. The difference is apoptosis is a programmed and necrosis is not. And we'll talk about cell death in the upcoming lecture. So, some basics, we'll talk about it now. As I said before, the cellular injury occurs when the cell cannot adapt the stress. It depends on three different things: stress, or type of stress, severity of the stress, and the cell type. And we'll give examples about them in the next slide. The cell type is such as neuron and the skeletal muscle are example of difference in cell type will lead to different injury. Neurons cannot adapt for a long time, and it usually has an ischemia, whereas the skeletal muscle can adapt and can afford the the damage for long period of time. Uh, the severity of injury also play important role in cellular injury, such as ischemia. We have two types of ischemia: developed ischemia or acute ischemia. Developed ischemia, such as in the renal arteriosclerosis, it will lead to cell atrophy. Then it will become an injury to the kidney, which is the renal failure. The acute ischemia is where we have the renal artery embolus. When we have an embolus or a thrombus in the renal artery, we won't have the uh, the atrophy to the kidney. We will have the injury immediately. The causes of cellular injury are different. One of these causes are the four I listed here. First one is inflammation. We don't have to explain why because it's obvious. Uh, Secondly is deficiencies. Any type of deficiency in the cell will lead to cell injury, such as nutritional deficiencies or ions deficiency. The third and the most common example, and it's very high yield, that's why I highlighted in red, is the hypoxias. Any type of hypoxia or any cause that lead to hypoxia, it will lead to cellular injury. And finally, and by the way, we will talk about hypoxia in the upcoming slides. And finally, the last cause is damages such as trauma or any genetic mutation in the cell. Hypoxia. Hypoxia is what is hypoxia? Hypoxia is when we have low oxygen going to the tissue. When we have decrease in oxygen going to the tissue, this will lead to low ATP. Why? Because we cannot or we won't have the oxidative phosphorylation, which will help in making ATP, and this will lead, when we have decrease in ATP, this will lead to injury. So when we have low ATP, we will have low ratio of oxidative phosphorylation. When we have it, we will have it will affect the sodium pump. It will make the sodium influx and potassium efflux. Efflux means going out of the cell, and as we know that when sodium goes to anywhere, water follows immediately. So more water and more sodium will lead to or will influx inside the cell, and also the calcium pump will be affected. More calcium will go inside the cell, and this will lead to cell swelling, rough endoplasmic reticulum, and loss of microvilli. And these are the important signs of injury, and we'll talk about it in the upcoming slide. By the way, any damage in the calcium pump, we said that the calcium will go in. When calcium going in, it will stimulate the cellular apoptosis, and will lead to enzymes going inside the cell and kill it. Also, when we have low ATP and we have low oxygen, glycolysis will happen. Glycolysis will lead to low glycogen and increase in lactic acid. This will lead in decrease in pH and will lead to nuclear chromatin clumping. And also, when we have low ATP, we will have something called ribosomal detachment. As we know that ribosomes are found in the endoplasmic reticulum, rough endoplasmic reticulum. And when we have the swelling in the rough endoplasmic reticulum, it will lead to ribosome will be detached from the endoplasmic reticulum, and ribosome in general help in protein synthesis. So when we have defect in that, low protein will be synthesized. We have to catch everything together and make it as a one picture. So now, what are the causes of hypoxia? Hypoxia has many causes. One of them is ischemia. Ischemia and hypoxemia and low oxygen carrying capacity. And we'll talk about each one of them separately. First one is ischemia. Ischemia means when we have low blood going to the tissue. So when we have low blood carrying oxygen to the tissue, this means that when we have low blood, it will lead to low oxygen, then it will lead to hypoxia. And we have three types of ischemia. First one is arterial ischemia, which is an example of arteriosclerosis. And secondly, we have venous ischemia, which occurs in syndrome called Budd-Chiari syndrome. It's a very rare case. It occurs in 1 out of 1 million. What happens there is that we have an ischemia inside the portal vein. And finally, the third type of ischemia is something called generalized hypotension, and this will result in poor perfusion in the tissue. Hypoxemia. Hypoxemia is different than hypoxia. The difference is, as we said before, hypoxia is low oxygen going to the tissue, whereas the hypoxemia means low oxygen in the blood in general. the PO2 is less than 60. And hypoxemia has many causes. First one is the high altitude. For people who have who live in high altitude or the mountain climber, uh, the the they usually suffer from hypoxemia because in high altitudes oxygen is low. So when we have low oxygen up, we will have the PO2 will be less than 60, and PCO2, which is the oxygen pressure in the body, will become high, and this will lead to hypoxemia, and after that it will lead to hypoxia. Also hypotension, it means slow rhythm in breathing. So when we have a hypotension, then it will keep the CO2 or carbon dioxide inside the body for a long period of time, and this will result in low oxygen in the body, and then it will lead to hypoxemia. And diffusion barrier defect, the third cause. Uh, it occurs in interstitial pulmonary fibrosis, like cystic fibrosis, when we cannot do the gas exchange in the alveoli and the blood. Usually we, or all the time we exchange, we take the oxygen from the alveoli and put the CO2 or carbon dioxide from the blood to alveoli to exhale it. And finally, we have the VQ ratio, ventilation perfusion ratio. It will be defected or mismatched. The blood pressure in the oxygenized lung will be low, will be high, but we cannot exchange it. It occurs all the time in asthma patients. So this will lead to ventilation problems. The third cause of hypoxia is low or decreased oxygen carrying capacity. We have three examples or three most common causes of it. The first one is anemia. Anemia, when the red blood cell will change its shape, so it cannot carry oxygen as much as it carries in the normal situation. And the second cause is CO poisoning. CO means the carbon monoxide. Carbon monoxide in general has higher affinity to bind and to hemoglobin than oxygen. So people use carbon monoxide to suicide in general. They close on them their garage and they turn on their cars and they inhale the carbon monoxide. This will lead to something called CO poisoning. The oxygen in the body, pressure oxygen in the body will be normal, but the defect is in the saturation of oxygen. People with the CO poisoning, they will have red cherry appearance of the skin, and uh, it will start by headache. After that, it will lead to coma, then rest in peace. And the third cause of decrease, etc., is methemoglobinemia. Methemoglobinemia, it means in the normal cases, in the hemoglobin we have iron, and iron in the hemoglobin is not in the oxidized situation, which is the Fe2 plus. So when it got oxidized, it will decrease the affinity to bind to oxygen. So hemoglobin cannot bind to oxygen if the iron in hemoglobin is Fe3. So people with that, they will have chocolate chocolate colored blood, and they will have something called cyanosis. They will have a blue skin, such as the Smurf I'm showing in here. And it got treated by something called intravenous methylene blue. It will just make the Fe3, the oxidized ion, become non-oxidized. Uh, After that, we will talk about why we have the injury. Why we have the injury uh, when we have the hypoxia. As I already said that before, that when we have hypoxia, we will have low ATP, low oxidative phosphorylation. This will lead to sodium potassium pump damage, sodium influx, water will follow. After that, calcium channel will be affected. Uh, Calcium influx, it will help in apoptosis enzymes to be released, and after that it will do, or thirdly, it will lead to glycolysis and increase lactic acid, then decrease the pH. We have two types of injuries, reversible and irreversible, and we will talk about them now. Reversible injury, the most important sign, and it's the sign when you see it in the cell, you will say it is injured, but it's reversible, so we can treat it and get it back to the normal situation or homeostasis. The sign is the swelling. Swelling, when we have swelling in the plasma membrane, mitochondrial membrane, rough endoplasmic reticulum will damage other organs, such as when we have the plasma membrane swelling, it will lead to loss of microvilli of the cell. It cannot move. When we have the rough endoplasmic reticulum, as I said before, it has the ribosomes. When it got swelled, the ribosome will be attached. So ribosome help in protein synthesis. Then we won't have protein synthesis. The irreversible damage, uh, the most common or the most important sign in it is the membrane damage. Irreversible injury, the damages will occur in all membranes, such as plasma membrane, mitochondrial membrane, and lysosomal membrane. In plasma membrane, when it got damaged, uh, a lot of water or nutrients outside the cell will become in. Then it will lead to cell explosion. And mitochondrial membrane, the membrane of mitochondria, when it got damaged, it will release something called cytochrome P or cytochrome P45. This cytochrome P45 will help uh, to to make the cell go in the cellular apoptosis. It will activate the apoptosis. It will do the same as the calcium does. And finally, lysosomal membrane. You can imagine what will happen when we have a damage in the lysosome membrane. And that concludes our session today. Hope you got benefit and have a nice day. And these are the references.